Welcome back to Wave 3 Listens. Perhaps you have a loved one, a senior, who needs a little bit of help. Maybe senior living would be appropriate. I'm going to talk to some folks from Todd-Dickey Nursing and Rehabilitation Center. Once again, Todd-Dickey Nursing and Rehabilitation Center. With me now, Angela, I want to make sure I pronounce this well. Right. Wolkoff?
Perfect. Yeah.
I did it right?
You did.
I struggle with that. Welcome to the show, Angela.
Thank you very much.
All right, Elizabeth McMillan. Well, welcome, Elizabeth.
Thank you.
Look at all these pretty smiles. See? I love this. You can feel the compassion in the room. Abby Polster. Welcome, Abby.
Thank you.
All right, ladies, let's talk a little bit about Todd-Dickey Nursing and Rehabilitation Center. If you had to say a little overview, if you would, Angela, how would you describe your facility and exactly what is the mission?
The mission is helping people live better, really. It's helping people return to their prior level of functioning, helping them live to their optimal lifestyles. We're helping them to have a better quality of life. It's a very homey atmosphere at Todd-Dickey. Everyone treats everyone like, they're their grandparent or their mother. Lots of hugs and kisses on a daily basis. It's a very, very nice, homey environment.
I love hearing that, because I think if you want something for a loved one, a senior, that's what you want most, is for them to feel emotionally connected and feel loved and cared for.
Exactly.
So that's, I think, maybe the most important part of a facility.
And even as someone who works at a facility, it's nice to feel everyone's so engaged in everyone's recovery and in their stay. I mean, it's a wonderful thing.
All right, Elizabeth, asking you a question here. I hear you guys and you talk about moving forward rehabilitation. What is moving forward? How do you define that?
That's our rehab to home. So that's people who are there from the hospital and they come for a stay in order to rehabilitate themselves, get back on their feet, and get back to living the way they were before at their prior level of function.
I love that. There you go. That's, in other words, we're moving forward. We're getting better. Let's get you there. All right. That's our mission, is to make you feel 100% better. Abby, talk to me a little bit about maybe some of the functions that you have, things that maybe make Todd-Dickey so special.
I think the main thing that makes it so special is that the way we work together. If someone is having a problem doing anything, we know about it, and the staff communicates on many different levels. So say if someone's having difficulty getting dressed in the morning, we're on it, and first thing in the morning we're in that person's room and we're assessing how they're doing it and making sure that we get the problem resolved.
Okay, Elizabeth, speech language, if there's any, I guess, inabilities there, any challenges there as far as speech and language, you can help?
Right, or swallowing, cognition. That's what a speech language pathologist does. I diagnose and treat people with problems with cognition, swallowing, and communication disorders.
Angela, if someone, let's say a resident needs a modified diet, they need a certain diet or deficient in certain vitamins, you can help them there as well.
Correct. Elizabeth is the speech therapist, but what she will do is she'll look at somebody. The nursing staff will let us know if someone is having problems swallowing. There's different signs to look for. If they're coughing or if they're having their nose is running or watery eyes, and they'll let us know that. And Elizabeth will go in and she'll look and when they're eating and see if she notices any sort of difficulty as well. And then she'll look at possibly if they need to have some sort of diet modification, and with that she'll pick them up and she'll work on strengthening their oral motor muscles to make their swallowing more efficient and safer. And she also has an electrical stimulation unit called Vital Stim that she will hook up to the muscles used for swallowing to help rehab them, to make them stronger, so to perhaps be able to get them back to a regular diet, which, food is everyone's greatest pleasure, really. So to be able to have a regular diet is truly a blessing for anyone. So that's a really wonderful blessing that Elizabeth can bring to the residents.
And Abby, you're an occupational therapist.
Right.
Now, occupational therapist means something different for everyone, but in this case, your residents, it's really about being able to function day-to-day life, correct?
Right. The activities of daily living is what we focus on: bathing, dressing, using the toilet, anything that you do on a normal basis that after you've fallen or after you've had an onset of dementia, you're having difficulty doing. That's what we focus on.
And Elizabeth, I'm sure you have a lot of heartwarming stories, people who improve and feel better. Is it nice when maybe the family of one of the residents comes in and sees a marked difference, an improvement? I would think that's very rewarding for you, correct?
Sure.
It is, especially if we can get people back to where they were, and if we can get people back to going home and happy and functioning in their life. That's what we're all about.
Let's be honest here. It's God's work. I mean, it really is. I mean, it really is. I know you guys, I know it's a job for you, but on the other hand, I can tell you enjoy your work. And I think that compassion comes across. Angela, if someone's been watching and they're interested in Todd-Dickey Nursing and Rehabilitation Center, what would be the first step? Would they call? Can they tour the facility?
Yeah, tour the facility. They can call the facility. The facility, 812-739-2292. Just call and let us know that you'd like to come check us out. Anytime you can come in and take a tour. We're all there willing and able to answer any kind of question you might have and show you around. Somebody is always there and ready to do that. We not only specialize in sending people home, but also for our residents who live there. I mean, we want everyone to function at their highest capacity, and we help them in their rooms, to become more independent, the people who live there, and as they mentioned, dementia and Alzheimer's as well. I mean, it's important for everyone to maintain some level of control over their lives. And even if you're losing your short-term memory or you're losing some aspects, it's nice to know that, hey, I can at least stand up, or I can at least be able to feed myself, or I can at least sit up on the side of my bed. And we want to enable them to be able to keep that level of control for as long as they possibly can.
It's a dignity factor, isn't it?
For sure, it definitely is.
And I think for you, the respect that you have for the residents is very obvious to me as well.
Yes.
Again, I appreciate what you do. I was looking at some of those pictures of your facility.
Yeah.
I was fearing growing old. Now I'm like, hey, can I sit back? Let's go to Todd-Dickey. I'm good with it.
It kind of looks like an old ski lodge. We say all the time.
It
sits
is
down in a hill. Yeah,
it's beautiful.
Really pretty. Yeah.
It's beautiful.
It sits next on 62 next to the Overlook restaurant. So if you've ever heard of the Overlook out on 62,
that's like a beautiful fall view.
Yeah, we're right down the road from that.
The Overlook, is it still open?
It is. It is.
So if I go there and I'm a resident, you wouldn't mind if I wander over there?
Well, we might wander
have
with
a cold beverage.
We might wander with you, but,
okay.
But yeah, you can for sure. Because we do as far as therapy. I walk people around the square and stuff outside all the time. So yeah, that's definitely an obtainable goal.
All right, I love that. Yeah, this is really a beautiful facility.
Yeah.
I encourage folks, if you're thinking about senior living, if maybe it's that time for a loved one in your life, then consider them. Todd-Dickey, it's the Nursing and Rehabilitation Center. I wanted to get it all out there.
Great.
Ladies, thank you all so much for spending time with me.
Great, thank you for having us.
That's right, all those smiles. Come on, let's see them. Yeah. I feel like Charlie of Charlie's Angels. Look at this. I mean, it's ridiculous. Anyway, really, thank you very much. I appreciate you all coming on the show. Okay, again, it's Todd-Dickey Nursing and Rehabilitation Center, and you've got all the information. Give them a visit today. We'll be right back on Wait 3 Listens.